Well, greetings again. This is Dr. Bill Wyatt, and I'm going to talk again about some things I learned while in Africa. Now, I got out of dental school in 1955, and I did my first orthodontic case back in 1956. And to learn as much about what I could do, I knew I was going to be confronted with orthodontic problems there in Africa, and I learned as much as I could about every branch of dentistry that I could learn about in the 6 years I had. And my wife and I went at night to the seminary and learned how to be missionaries in a sense. And so when we got to Africa, you were thrown into situations that you couldn't think of actually preparing yourself for them. But it was interesting to learn things that I did. Now, let's just get started. I don't have any pictures to show on this, but I can show you some different things. One of them is how orthodontic problems develop here in the States. It helped me know that. So I had a real busy practice there in Ibadan, Nigeria, and we worked on the highfalutin African people and also the American people there. With the American government sent people there to train people how to farm and do different things and help them. So we saw a lot of upper class people, and then we saw a lot of people from out in what we call the bush, out in the little villages and the towns out away from Nigeria, away from Ibadan, where we were first practiced there. All right, let's get started on this. The first thing I got there, they wanted me to take the students or the young people that worked in the dental office and come to this school and clean all their kids' teeth and check them for cavities and orthodontic problems. So we packed up our group, and I took a air turbine deal for doing fillings and all that, and we set it up and set this chair up, and had to have a generator to get the thing to going. But when we got there, I took every child in that school. We cleaned all their teeth and everything, and there was not out of this whole school, I filled only 12 cavities. These young people never ate anything sweet to speak of, and they had just virtually no cavities. And there were children there up to about 12 or 14, stuff like that. And this just didn't happen in the United States. I mean, these people had virtually no cavities. And I thought, well, what's caused that? And I found out they never eat anything sweet to speak of, or it would be a very small amount. Of course, they brush their teeth with a chew stick and just kind of clean them up a little bit like that. But none of them had any cavity. Well, there were 12 or 14 people that we filled their teeth, filled a few cavities on, and that was all in that whole school. And orthodontically, there was not a single person there that had crooked teeth. One person had a supernumerary tooth coming in, that's the extra tooth, and I took that extra tooth out, and they had straight teeth. All of them, just virtually the whole school had there was just no orthodontic problems at all. And I wondered how on earth this could happen. And so I had to do a little research and finding out how this actually took place. Now, one of the things that African children back in that time, this is the early 60s, they had very little protein to feed the babies. And so when a mother got pregnant and had a child, she had to nurse that child for about 2.5 to 3 years. If she didn't, the child would come down with what they call kwashiorkor. And that is where the child, I've got a picture of one of them. I was starting to take his picture and he didn't want me to take it. As he walks away, I couldn't resist. I shot the picture of him, and his stomach stuck out on each side. It's like having a watermelon in his stomach of this little kid, maybe 10 years old or something like that. And of course, he passed away. And they call that kwashiorkor, is the younger kills the older child. So if the mother has a child and he's about a year and a half old, and she has another child, then the younger child gets the breastfeed and the other one doesn't. And the one that goes without the protein in the mother's milk, that child will develop that stomach like that and pass away. And they call it the younger kills the older person. And that was something that an eye-opener to me. I saw this child out in a bush, really backward, way off out. We were hunting. I saw this child like that. And that was something that really made you feel sad for this poor boy that never had the protein that he needed, and he would pass away like that. Now, we found out also by the children nursing as long as they did, they all developed, their airway developed. A lot of the kids ride on the back of their mother, and they nurse, they slide around during the day and nurse off and on for about 2.5 to 3 years. They stay with the mother like that, and the father goes off to another village and stays until they get old enough so they come back and they can have other children. Well, these children that nurse that much develop their airway, and I learned that that's one of the big problems here in the United States, is we have so many allergies and things that children cannot breathe good through there, and so they use they suck their milk out of bottles. It's almost impossible for a mother here to nurse that much, spend that much time with each child. And so we have this problem here in the United States. Now, another thing that I learned is that these people in villages and things had been there for years and years, and the people around the villages, a lot of them were the same identical people. And so everybody, they married, the father and the mother matched up, and the children would have teeth that fit their mouth. Now in the United States, everybody here is mixed up about as much as you can possibly get. And so we'll have a person that has a large facial structure and has large teeth, and he may marry somebody with a thinner face and smaller teeth, and if the offspring of that marriage, the person will get the skin of the big person, then the ectodermal layer that the skin comes from is the same one that develops the teeth, like here. So if that person has the skin color of the large person, then they'll have the large teeth. And they may not have the bone structure to fit those teeth. So over here, many people have to reduce the number of teeth they have to get them back in the mouth where the person looks good. And in there, everybody was protrusive, full, but they all had the teeth that fit the skeletal structure that they had. But when I got home, well, I knew this to start with. This was one big cause for malocclusion here. Now, if a person here, if a mother can nurse the child for several years, I mean 2.5 years, something like that, they'll develop much better airway. You cannot nurse, the child cannot nurse and breathe through the mouth. So if a person can get the milk from a bottle or get it real quick, and then they breathe through their mouth, if they breathe through their mouth, the lower jaw is going to get wider than the upper jaw, and they'll have cross bites and all sorts of things develop from mouth breathing. And I learned that fact, that so there is a place where the child has, and what happened while I was in Africa that showed this to me without any question of that at all. I had a family of American, what they call American blacks. They were not anywhere like as black as many of the African people working in the office with me. They were just kind of at least half or 2 3/4 Caucasian and maybe part African. Well, I had a family. The father had a doctor's degree in agronomy. He was there teaching them farming. The mother was very educated. She was the university librarian at the University of Ibadan, Nigeria. And they had 2 daughters. The older daughter was light complected like the mother and the father, but the younger daughter was a neat, really wonderful personality, but she was blacker than her sister or mother or her father. And she was black. She had an African skin, and she had an African tooth, and it didn't fit her at all. And it just would not work. And so we had to remove her bicuspids, and I think I don't think we ever got her wisdom teeth out. Didn't see her that long to wait for it, but somebody probably had to take them out to get the rest of them in the mouth. But I learned at that time that this question of should you extract and not extract is a ridiculous question. And people with the large tooth from one side of the family and a small skeletal structure, you should reduce the number of teeth in most of these people. But that's something I learned there in Africa, and I brought that home with me too. Now, I look for people, my whole practice, for several years, hunting for somebody that had just ideal teeth, but had never had any orthodontic work done at all. And I had not found a soul that was that way, had just a perfect set of teeth with all the 6 Ks, the occlusion, everything in there, but had never had any orthodontics. I didn't find anybody. But one day it dawned on me, I was working on my wife's teeth. Her teeth were that way. She had an ideal set of teeth. They fit, and she breathed at night with no problem at all, and I'm sitting over there having to sniff or use a CPAP to get air in, and she's over there breathing, no problem at all. She told me later on, says she had grown up out in the Coxsackie National Forest, and she was there with her mother by herself. Said, I nursed till I was about 2.5 years old, and I was kind of embarrassed to do it, but it's that she nursed for a long period of time like that, and she had an ideal set of teeth, and luckily her father and mother had a similar size of facial structure. So I would want to pass that on to you too. These are vital things that you learn during life that really help you understand orthodontics. And so I like to pass that on, and some people, well, think you're opposed to the black people, but I am not. And so I thank you for watching, and I'm going to sign out here. And if you see this or you read the videos that we have, you will know these are some things you can learn from somebody else and not have to go through the experience of living in the area to find out something like that. So thank you for watching, and I'm going to sign out here, and we hope you'll join our group and subscribe to our channel. And we are very grateful for the media now that allows us to come on here and talk to people or show you in videos what can be done orthodontically, and we're trying to pass this on as best we can. So thank you for watching, and I'm going to close out now. Thank you.